COVID-19 cases are surging in Texas right as students prepare to head back to school, a timing that couldn't be more concerning for families and communities across the state. Wastewater analysis from last week reveals a stark increase in viral presence, signaling a significant uptick in infections. But here's where it gets controversial. Despite fewer hospitalizations and deaths compared to previous waves, the virus continues to spread at a pace that many experts warn is alarming. So, what does this mean for you and your loved ones? Understanding the nature of the latest variant driving this surge and effective ways to safeguard your health is more crucial than ever. Are COVID infections escalating in Texas now? The answer is a resounding yes. Data from the U.S. Centers for Disease Control and Prevention, CDC, showed that the amount of viral material found in wastewater across Texas last week reached a very high level, a rate that surpasses both national and regional averages. This increase was notably evident in multiple locations within Harris, Montgomery, and Galveston counties near Houston, areas where viral concentrations are notably elevated. While the current numbers of COVID-triggered deaths and emergency room visits remain far below the spike seen in earlier waves, the virus is nonetheless climbing in 34 states, including Texas, according to CDC projections. The latest surge is especially concentrated in the southern and western regions of the U.S. Within the Southwest, encompassing Texas, the rate of positive COVID tests jumped to 11.4% over the past fortnight, a significant rise from 7.6% in the preceding 2 weeks. Interestingly, Texas recorded the second highest emergency department COVID diagnosis rate last week at 2%, marking a 17% increase over the previous week. This raises important questions about the potential strain on healthcare services and whether precautionary measures are being sufficiently observed. What variants are fueling this rise in cases? The dominant strain currently sweeping through Texas is the XFG variant, also known as Stratus. This variant has been steadily growing in prevalence across the United States since May and accounted for about 65% of all COVID variants in recent samples as of August 9th. In contrast, the LP 8.1 variant, once more widespread, now makes up only about 7% of detected viral activity, continuing a decline that began in April when it represented over half of circulating variants. Another variant that made headlines earlier, the Nimbus variant, which received attention due to patient reports of particularly severe sore throats, has diminished significantly and was not detected in last week's wastewater tests. What symptoms should you watch out for? The list of COVID symptoms remains broad and includes fever or chills, cough, difficulty breathing, sore throat, runny nose, fatigue, muscle aches, loss of taste or smell, nausea and diarrhea. The CDC has yet to specify unique symptoms for the XFG Stratus variant, but so far there's no indication it causes more severe illness than previous strains. Vaccines authorized by health authorities continue to offer protection against this variant, reassuring many public health experts. So, how can you keep yourself safe amid this surge? The CDC advises everyone to stay up to date with COVID vaccinations, maintain good hygiene practices like regular hand washing, and opt for outdoor gatherings instead of indoor ones when feasible. If you feel unwell, it's crucial to stay home until your symptoms improve and you've been fever-free for at least 24 hours. This simple but effective strategy helps limit spread, protecting both you and those around you. And here's the part most people miss. While the current wave might not be as lethal as past surges, the high transmission rates mean vulnerable populations remain at serious risk. And the potential for new variants to emerge persists. Are we doing enough to protect these groups, or are we risking complacency in a dangerous moment? What are your thoughts? Do you believe communities and individuals are responding adequately to the ongoing COVID threat in Texas? Or is more decisive action needed from public health officials and the public alike? Share your perspectives and let's start a conversation about how best to navigate these challenging times. This report was compiled by Malia Ellis, Kirst Fellow at the Houston Chronicle, originally from New Haven, Connecticut, Malia is a graduate of Harvard University, where she majored in social studies and contributed to editing the Harvard Crimson's weekly news magazine. Prior to joining the Houston Chronicle, she gained valuable reporting experience at the Pittsburgh Post-Gazette, the Boston Globe, and the San Francisco Chronicle, focusing on critical topics like climate change, seismic safety, and public health.